Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane with the Ask Dr. Pane weekly YouTube segment. And Dr. Pane, we have a question this week that comes from Instagram, and the question is about the Mommy Makeover. This person is going to be getting a Mommy Makeover pretty soon, and they've been told that it might last up to 8 hours. So they're wondering, is this safe? And what would you suggest in this case, Dr. Pane?
Well, that's a good question. Now, we don't have full amount of information there about exactly what's being done with this mommy makeover, but the most common combination for this procedure is some kind of breast operation and a tummy operation, usually a tummy tuck, and say either a breast augmentation or an augmentation with lift. The time of surgery is a tricky issue because in general, people do better if the surgery is kept on the shorter side, if you can do so. Now, in Florida, we have rules on the length of surgery for the outpatient office setting that a maximum of duration of 8 hours. Typically, though, most of us that are a little careful want to keep that below that time, because if we have any issue that needs extra time, we have a little margin of safety there. So I don't like to do surgeries that we know are going to be longer than 6 hours going in. If this person is having a breast aug with lift, and it's a full type lift, and say an extended tummy tuck, that still should not take more than 4 hours or so, 4.5, depending on who is doing it. So at a length of 8 hours, they were told they were going to have a surgery that's 8 hours. I get concerned that maybe they're doing other things, and if that, or the person is maybe not that experienced at this kind of work. So for that case, the person might be better off staying overnight in a hospital if they're having that length of surgery. And some places will do that if they're doing extensive body contouring at one time, arms, thighs, abdomen. But by and large, no matter who's doing it, where it's being done, longer surgeries are going to have a higher chance of a problem where you might need to have, some kind of hydration overnight. There could be other complications that we don't even want to think about. So in general, the shorter the better. What we do in our practice, we try to keep the surgery shorter. That doesn't mean we don't do combinations, we do. But almost 100% of the people will go home that night. And we find actually the complication rate is very low because it's better to be able to be up and around and to do the surgery in a way that you're not overdoing it. 8 hours raises some concerns for the reasons that I have described, but it may be okay under certain conditions depending on exactly what's being done, who's doing it, where that's taking place. So by and large, the time alone, not particularly, not a 100% meaning that it's unsafe, but it's something that needs to be looked at a little closely. And in general, keeping it under 8 hours is going to be better in most cases.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our website or Facebook page. And Dr. Pane, we appreciate your time, and we'll see you next week.
Great.